I'm Mike Royer with an extended interview in this Health Matters Web Extra. It's time for another edition of Health Matters. We're joined today by Dr. Brent Lehman. He is a hospitalist. And am I pronouncing that correctly?
You are, absolutely.
I didn't want to come out of the gate with the bad pronunciation.
No, that was perfect.
We have done a segment before about hospitalists, what they do, play an important role, and a role in the hospital that is becoming more prevalent.
Right.
Tell folks that may not know exactly what a hospitalist is.
Well, so basically a hospitalist is we're primary care specialists who focus on just taking care of patients who are admitted to the hospital. So, we don't have clinics we go to. We just take care of patients while they're in the hospital, so we can focus our time on that.
I see my physician in the office. If I were hospitalized, I doubt I would see him. I'm pretty sure my doctor doesn't make rounds.
Right.
I would develop a relationship with you or someone like you in my hospital, and there are advantages to that. What are some of the obvious ones?
Oh, the big thing is that we're there.
That's a big one.
There are still a few doctors who make rounds both at, make rounds at the hospital and see patients in clinic, but that's really becoming uncommon, number one. But the ones that do, once they come to the hospital, they get there and they've got to be at clinic at 8:30 in the morning. Something changes at 2 o'clock in the afternoon, they're not there to take care of it. And then the other thing is we're really there 24/7, 365. So we have people who work day shifts, swing shifts, and night shifts. So we always have a doctor in the hospital in case something happens.
You know this, but I don't know if we laymen always think about it. In a medical situation, you're more comfortable with a face that you've seen more than once.
Absolutely.
That is a big advantage. If I'm in the hospital for 4 or 5 days, I might see you every day or someone like you every day and
Usually
develop a comfort level too.
Right. Yeah, and again, I'm not going to pretend that's the same as the doctor that you've been seeing for 15 years, but we communicate, and that's probably the most important thing we do is keep in touch with the doctors in the community and let them know how their doctors or their patients are doing.
Sometimes it's not just the chart hanging on the end of the bed. You will actually talk to a physician if you think you need a little more information.
Oh, absolutely.
Or guidance.
Yeah, definitely.
Also, the training for a hospitalist is interesting. Unlike a specialist in orthopedics or heart or something else, you all, the men and women who are hospitalists, have a more general training area, maybe family practice, internal medicine, where whatever the issue, you can handle that.
Yeah, right. So internal medicine, and a lot of people have their primary doctor, then have a heart doctor or a GI doctor they see. Those are all subspecialties of internal medicine. So we do 3 years of training, get a little bit of everything, continue to do that. Some people go on and just do one thing, but internists and family practitioners are, we're equipped to handle everything. And then if you need some assistance from a specialist, they're available to you.
Let me backtrack a bit. You mentioned 24/7. If I'm in the hospital and I really do go into some stress or trauma and I need attention quickly, they don't have to call my doctor at home. The hospitalist
we're there.
Might be on the same floor even
Absolutely.
or down the hall.
Right, and easily accessible.
Yeah, and how does that work? Might a nurse just page you, call you, yell down the hall? How does it work?
Well, and like I said, we're there. So
they just find you, get you in
exactly.
there.
We have our pagers, we have cell phones they can call us, and so if something does happen while we're there, we can usually be there right away.
Sometimes patients think doctors come in, look, make a mark and get out of there, and they go, oh, I meant to ask them this. I would imagine since you're there and you're not leaving to go back to the office, there might be a little more opportunity to comfort, to inform, even educate a patient. Just, here's what we're dealing with now, here's what you can expect. Go through that scenario for me.
Well, just thinking through an example, like if you see someone in the morning, everything's going well, but then there's a change. Again, we don't have to leave the office to come back. We can just go back and check on somebody again. Communication has been a real challenge with COVID right now.
Sure.
We've done some things where we set up FaceTime calls and Zoom calls with families to make sure they know what's going on with the patients while they're in the hospital.
But the patients themselves, you can be in there safely with them, mask or whatever,
Sure.
And have full conversations and probably answer
Absolutely.
any questions they have.
Mm-hmm. And come back later in the day if we need to. I mean, it's not uncommon for us to round on one patient 3 or 4 times in one day if it's needed.
What would your advice be to someone who may be going into the hospital, have a loved one that's scheduled to do something routine in the hospital? Do they need to inquire when they go in? Now, I've heard about a hospitalist. How do I go about doing this? How does it work? How will they connect with you?
Well, again, most of the doctors who don't come to the hospital, so if you have a primary doctor in the community, will usually have an arrangement with with a hospitalist to take care of their patients in the hospital. At our place, if you don't have a doctor that you're assigned to, we have a system in place to make sure that someone assigned to you to admit them. And then one thing that happens with me, I've lived here for 20 years. I've got a lot of friends and family in the community, and so if they know someone's going to the hospital, they call me and just make sure that they get admitted to our group.
You might have found them anyway, but they're guaranteed that they see a face
Right.
that they know. A unique arrangement between the University Medical Center and DCH. Hospitalists from the University Medical Center are working on staff at DCH now on a regular basis, correct?
Yep. We have 18 doctors in our group.
Wow.
And so 7 during the day at the hospital at any one time, and then we have people that cover in the afternoon and evening.
So on the overnight shift, there might be 2 or
Well, we have one that stays in the hospital all night long.
always
Right.
there.
Yep.
So if you're using doctors in your group, there's always a doctor there.
24/7,
Anytime.
365.
Very good. Unless you have a weekend off like you have coming up, right?
Well, there's still someone else to be on
I know,
call.
it's covered.
And
Anything
unfortunately,
else?
I'm on call 24/7,
So
365 for our group.
you think you have a weekend off. You may or may not have a total
Unless
weekend
something
off.
comes up.
Yeah.
So,
It must be an enjoyable part of your practice.
what's that?
Being a hospitalist, I would find the variety of it enjoyable. And I don't know
It
what it's like to be
is.
a doctor, but I would think variety would be good for you as well.
It is. And I actually did 4 years in private practice or traditional practice before I became a hospitalist. And I do miss some of the relationships we had with the patients. I do miss that.
Yeah.
But the challenges of taking care of patients when they're really sick and knowing that what you do made a difference immediately, that's something that's always appealed to me. And I just like being with the nurses, and we have great staff at the hospital to work with. And the best part about my job is the people I work with. We've got a really good team of doctors.
I've only been in the hospital once since I was born. That's good, and I'd like to keep it that way. But if I have to be in, I'm glad to know about this program
Sure.
and to know about physicians like you. Thanks for sharing what you all do with us today.
Absolutely. I appreciate you having me on.